Welcome back to my channel. In today's video, we are going to learn about amniotic fluid and fetal blood examination. Okay, so before getting to the topic, in this lecture or in this video, we'll have a detailed view of what an amniotic fluid, where is it present, what is the use of it, and how is it collected, and why is it need to be collected. And similar process is also for the fetal blood examination. Okay, so let's get into the topic. What is an amniotic fluid? Amniotic fluid is a clear pale yellow liquid which is actually present around the unborn child in order to protect it from any other damages. Okay, so next, amniocentesis. What is amniocentesis? Amniocentesis is a procedure of drawing amniotic fluid. So amniocentesis is a test which is usually done mainly to diagnose that the unborn child consists of any other genetic disorders or any other birth defects or any other infections or infectious problems, so that which helps the doctor to treat at an initial stage. Okay, and the main thing is amniotic fluid is usually done, and that is the process of amniocentesis is usually done between the 15th and 20th week of pregnancy. Okay, so now let's move into the next topic, is that what's the need to be done. Amniocentesis is majorly done to detect that whether the child is suffering from any other genetic disorders or genetic testing, and whether it consists of any other infections, or in case of it is undergoing any treatment, which actually means that when too much of amniotic fluid gets drained, it actually causes problem to the children. So on diagnosis with amniocentesis process, it helps to remove the excess amount of fluid from the fluid. Next, it's also used to diagnose the fetal lung capacity of a unborn fetus, because in certain cases there is a premature labor happens, which means that the pregnancy happens at an earlier stage when compared that of the expected date. So in such cases, fetal may affect from any other disorders, or the organ development or lung development will be lacking. So similarly, in order to check that whether the fetal lung, and not only the fetal lung, any other organs are developed in a correct manner or not, this test can be done. Okay, and also it is used to diagnose the Tay-Sachs disease, and if the baby is having any neural tube defects also. And as I said before, most of the amniocentesis procedure usually takes place between the 15th and 20th week of gestation. If in case if it is done prior to that, or if it is done very after to that, means there is high chance of having risk like miscarriage or problems with pregnancy, etc. Okay, so what's the procedure to have perform this amniocentesis? Basic common procedure is that cleaning a small area in your belly and applying a special gel, and then moving a wand like disease over it, so that actually it's an ultrasound which actually gives a complete image of the fetus. Okay, so then, and with the help of the ultrasound, a thin needle is inserted into the abdomen, especially directly into the uterus. From there, the amount of liquid is drawn, and then the needle is also took to coat. Basically, the test is done in a very careful manner in order to determine, in order to check and verify that the fetal heartbeat and movement is normal. Now it does not turn into an abnormal, it should be a normal. Okay, so after doing this, the liquid collected from the amniotic fluid is directly sent to laboratory for further analysis. What are the risks of amniocentesis? So during the collection of amniocentesis, there may be some mistakes, so that which may cause several problems like miscarriage, or it can be like a premature labor, or it can lead to leaking of the amniotic fluid, even though loss of pregnancy, injury or infection. Okay, so next let's look into the fetal blood sampling. So what is a fetal blood sampling? Which actually means that it's a collecting of the fetal blood directly from the umbilical cord of the fetus. Okay, so the fetal blood actually is done, fetal blood sampling test is majorly done to determine that the child is suffering from any other blood disorders like anemia or something related to that, and also to monitor the oxygen level of the body. So the main aim of fetal blood sampling is to check whether the fetal RBC count and also the oxygen level. And this FBS test is done when a Doppler sound is occurs, and also it is also done as a serious result of an amniocentesis process. Okay, so how is it done? This procedure is similar to that of the amniocentesis procedure. A small area is cleaned using a small area is cleaned well, and then a local anesthetic is given so that it does not feel the pain. So small area of the belly is cleaned, and similarly ultrasound like a band-like disease is used, or it's spread over to monitor the fetal movement and fetal heartbeat. Okay, so as needle is inserted and small amount of fluid is withdrawn from the needle and collected, and then it's actually further sent to other laboratories for further process of test. So what's the need to collect the fetal blood sample? Major need is that it's used to diagnose the genetic problems like similar to the amniocentesis, and also it looks for it, the baby suffering from any other anemia or any other blood problem or oxygen level or any suffering from any other infections. Okay, what are the risks of collecting the fetal blood sampling? So the risks of collecting the fetal blood sampling is that there may be changes in heart rate, or it may cause certain infections or leaking of amniotic fluid, and finally which may lead to the death of the baby. Okay, so major thing is that fetal blood test is usually collected to determine the oxygen level and RBC condition of the blood baby. Okay, so next we will look into some of the tests which are involved, which mostly depends upon the amniocentesis and fetal blood sampling. Okay, so first we'll look into acetylcholinesterase test. Generally, cholinesterases are enzymes that are basically involved in helping the nervous system to function properly. So this acetylcholinesterase is actually involved in transmission of the nerve impulses by breaking down the acetylcholine. And acetylcholinesterase is a neural enzyme which is present in cerebrospinal fluid and fetal blood, and it's not at all present in the maternal blood. Okay, and mostly it's in it's a testing of an amniocentesis process, which means that it uses the process of amniocentesis, and directly it is as a result of an amniotic fluid test. Okay, so and the acetylcholinesterase test, if it is present in abnormal amount in the amniotic fluid, then which detects that the baby is suffering from an open fetal defect. So the specimen requirements includes that collection of amniotic fluid, especially of 2 to 5 ml, which is usually collected between the 14 to 24th weeks of gestation, and the process involved is polyacrylamide gel electrophoresis, which is commonly known as PAGE. So result. So as a result, when the single band, a major band appears, it means that the baby is clear, and baby is healthy, and it's a normal pregnancy. In case of 2 major bands occurs from the result, which determines that the baby is suffering from open neural tube defects. Okay, so next let's move on to the next test. So next coming are some of the common tests which you are going to learn, which usually includes about testing the fetus for lung, especially the fetal lung. As I said before, if baby is born before 39 weeks of gestation, that is before the prior planned baby, so the baby is having high chances of getting the lack of organ development, not only lung, it can be of any other organs. So similarly, here the test will learn its majority. Okay, so the first process is lecithin-estrus sphingomyelin ratio. They calculate the lecithin-estrus sphingomyelin ratio. Usually lecithin will be produced at a low amount, and it remains constant till 35th week of gestation. And this sphingomyelin is usually present at a constant rate after about 26th week of gestation. The normal values of L bar is greater than or equal to 2. Okay, so next is amniostat FLM. The test uses antiserum for phosphatidylglycerol and is affected by the specimen contamination with the blood. So next test is foam instability index. So this test is mostly done to detect the presence of the phospholipids. So what is done is a 0.5 ml of amniotic fluid is taken, and it is added to the increasing amounts of 95% of ethanol. It's shaken for some 15 seconds, and then it is allowed to sit undisturbed for 15 minutes. Then if a phospholipid layer is formed, which determines that the phospholipid is present even in presence of alcohol. So it actually confirms that a foam stability index. Okay. So next is microviscosity. Phospholipids generally decrease the microviscosity of the amniotic fluid. So in the tabular column, I have provided all the normal values and the significance. Next is the test for fetal distress. So fetal distress consists of 2 major tests, which includes bilirubin assay and alpha fetoprotein. So general optical density of amniotic fluid is normally highest at 356 nanometer, but it decreases to 550 nanometer when bilirubin is present. Alpha fetoprotein is the next common test which is done for fetal distress. So in this test, mostly the results are based upon the neural tube defects, which is majorly done using the process called automated immunoassay method. And the normal value will be less than 2 mom, greater than 2 mom will be considered as an abnormal. Okay, so next final one is the determination of fetal age. So fetal age can be determined by calculating the creatinine value in the amniotic fluid. amniotic fluid creatinine level, it ranges from about some 1.5 to 2, which means that if it is of 1.5 to 2, then it confirmly detected that a baby's age would be around some 36 to be. And if it rises above 2.2, then it can be confirmed that the baby's age would be around more than 36 weeks. Okay. And next one is in differentiation of the amniotic fluid from the maternal urine, which consists of creatinine and urea of 3.5 mg per deciliter and 30 mg per deciliter respectively in amniotic fluid, while in urine it can be of about 10 mg per deciliter and 300 mg per deciliter. Okay, so I think we have a clear idea of what an amniotic fluid is and how was it collected, need to be collected, and similarly the same for the fetal blood sampling, and also the other tests which are included to check for the baby's health. Okay, so with this I sign off. We'll meet on next video.